When people already have to come down from the mountainside, walking sometimes 3 hours, or being carried down the mountain if they are seriously ill, and then they come to our town finally and get to our hospital, and they cannot get basic services, it's a real health risk for these patients.
There were some lights that had been literally sitting on the floor for about 4 years because nobody in Ouagadougou knew how to hook them up.
If we were to move that equipment to those locations without it being modified for the electricity they have there, training people locally for maintenance, and then actually helping put the equipment in place, then essentially you end up with we're just basically redistributing junk.
We did in fact get a technician. He left saying that he would try to get the parts to be able to repair our equipment. I think it took about 4 or 5 months for us to know that he was not able to get the parts that he had hoped to get. My name is Sister Jacqueline Picard. I am a religious of Jesus and Mary, and I have been working in Gros-Mon, Haiti for the past 16 years, currently a member of the board of directors of a small Catholic hospital called Alma Mater Hospital. We already struggle to provide quality care to our patients, and if our equipment is not functional, we're fighting a losing battle sometimes.
My name is Georgia Winson. I'm the Executive Director of Hospital Sisters Mission Outreach, a medical surplus recovery organization that recovers medical supplies and equipment from 51 hospitals in Illinois and Wisconsin. We then assess and sort and repurpose those medical supplies and equipment to send to 75 countries in need around the world.
I'm Terry Tillett from Park Chapel Christian Church in Greenfield, Indiana. I'm in charge of the short-term missions teams. We recently sent a group over to Burkina Faso to work with one of our doctors that runs a medical clinic there. We can literally say their surgery has been in the dark, and because of Adama's ability and so on, it's helped tremendously already.
I've been doing global medicine since 1992, and in 1997 I was blessed to work with Mother Teresa. During that year I started TIMI Foundation, which became TIMI Global Health.
My name is Matt McGregor. I'm the Executive Director of TIMI Global Health, an organization based here in Indianapolis. One of the things that we do is support amazing partner organizations all around the world, medical clinics, nonprofits, hospitals that need resources, that need technical expertise to make sure that they can reach the poorest of the poor and make sure that those populations have access to quality healthcare. One of the most profound experiences that I had when Tim came on our most recent trip was that we walked in together to one of the supply rooms at the hospital and literally saw hundreds of pieces of unused equipment that after a quick review from Tim, he recognized that a lot of it could still be very valuable to the hospital.
Alma Mater, as a nonprofit hospital serving a rural poor population, we count a lot on the income from the services that we can offer with our biotechnical equipment, services that at least those who can pay for it will pay for, and then enable us to help those who cannot pay.
One of the things I've discovered is as you travel worldwide, people are very interested in the technology that we have in the U.S. I don't think they really know how to fit it into their healthcare system just yet. And so having that expertise, having 2 or 3 biomedical engineers on our trip, we can certainly be comfortable with the idea that it's not only fit into place, that it works in their healthcare system, but that it is a quite functional piece that will be maintained.
Without the services of TriMedx, hundreds of thousands of dollars worth of life-saving medical equipment would not reach people in need.
I have always been so impressed with the biomedical engineers who have traveled with us in the past, And not only are they outstanding at what they do, I mean, truly, it's like having MacGyver with you. And I can't explain how important that is when you are doing healthcare in some of the locations we go. But they were just great mentors with the students. They're always very friendly, very knowledgeable, a very important part of the team.
There's not that many organizations that have the expertise and have the ability to provide that expertise to hospitals in the developing world. And so without the support of TriMedx, I don't think Tierra Nueva was able to take advantage of their own resources and their own equipment that they have.
The biomed technicians sent to us by the TriMedx Foundation not only know the machines, they actually know the conditions in the developing world. And this is critical to make sure that the machines that are sent are valuable to those that we're sending them to.
Literally, they have helped countless people that are coming to this clinic now and in the future that are getting better readings from the test. Things are going to be done better surgically because they can actually see better. Tremendous help to those that go unseen by us.
So we're very grateful for the services of TriMedx Foundation. Many people's lives are saved because of the biotechnicians who come to support us on a regular basis.
What I keep saying again and again, what I like about what we do at TIMI Global Health and what TriMedx allows us to do even more so is to empower our partners in these other countries. We don't need entitlement programs. We don't need to learn helplessness. These are outstanding people who have great minds, great hearts, and with the right resources, they save the lives of some very, very wonderful people, and it's very rewarding for us. I think it's very rewarding for all the TriMedx engineers who travel with us.
We are truly grateful to the TriMedx Foundation and to all those who help them do the work, the wonderful, wonderful work that they do.